Hi, folks. Today is Tuesday, November 3rd, and a few things to talk about today. Number one, in general, our case counts in New Hampshire are going up. We were at about 20, 25 over the summer of new cases per day. We're up to about 130 on average per day over the last few weeks, and that's a product of a few things. One is more testing, but it's fall. People are doing more things inside. And also some COVID fatigue. People are around larger groups of people. They're maybe not wearing their mask. They're going to restaurants. All of those things are bad ideas. Right now, going to a restaurant is just not bright. I mean, there's just so many restaurants in our area that are closing because of COVID outbreaks. We have to be tight about that. It's just not worth the risk. In terms of large gatherings, being in smaller groups of people turns your risk down. And obviously wearing your mask, washing your hands, and so on. So what does that mean for RiverWoods? We've decided we're not going to go backwards in terms of our safety measures. We're not going to tighten up more right now, but we were on the cusp of opening up more, and we're not going to do that. So what does that mean to you for dining? Our dining directors are just smart and creative people that have been working so hard for you to try to find a way to bring our dining service back to normal, at least step one of back to normal. And they've put together a plan, which is great, and I'm not going to let them do that right now. We've asked them to put it on the shelf for now until we can do two things. One is have an engineering firm evaluate our airflow in the dining room so we can determine exactly how many people we can feel safe having in there at one time. And or if we need external devices, we've been trying out some external air purifiers to see if that will help. So some thoughts there. The other thing about dining is Thanksgiving. It's my favorite holiday. I've always loved it. Food, family, and football, kind of in that order. The Patriots stink this year, so that's off the table. But here's the thing. If you are going home or you're going to a family member's house for Thanksgiving, a few things we ask you. Keep the gathering size small. This isn't the year to have 30 people all together, eating, drinking, touching one another. This is a year for small, intimate gatherings with your family. If you have family who's traveling, obey the quarantine rules. They need to obey the quarantine rules if they're coming into New England, which means they have to quarantine for 14 days before they come and no public transportation. And if you leave New England, you need to obey the quarantine rules when you get back. So you'd have to self-quarantine when you get back to your community. In addition to that, a great idea is just keep windows open too. It won't be at your house because you live here. So, make your son or daughter crank up the heat, pay a little bit more for heat that day, but more airflow, more windows open, the better. So Thanksgiving, if you're going to a family member's house, please, small gatherings, just, be adults, be smart about it. We are anticipating that the case counts will go up after Thanksgiving as families get together. Second thing is if you're staying here, those really smart, creative dining directors, they are working hard on a way to have a number of options for you to have a great Thanksgiving if you're staying here. Creative, delicious ways to get together, but in a safe way. So more to come from them on that. A few other quick things. Testing, it's getting better. We have access to now PCR test, which is the gold standard, with 24, at worst, 36-hour turnaround on results. Compare that to what was 5, 6, 7, 8, 9 days in the spring or early summer. So that's good. We know. And when you think about the fact that we've had some positive staff members come out of our surveillance testing, but it's not spread as far as we know, not in any major way, I think that's a real product of having faster test results and proper PPE. Talk a little bit about, in the memo that will go out today, this Buy X Now test, which is a 15-minute test that costs $5. And when that's commercially available, which may not be until January because the federal government purchased all the first, I think, 150 or 200 million of them. But when it's commercially available, we'll be able to open up more because we'll have the ability to test a visitor right when they're coming in, and if they're negative, then they can come in. And the ability to test folks when they travel and test our staff even more often. So we're excited about that. We just can't get our hands on it yet, but as soon as we can, we will. So I just want to end by saying, one more thing. Sorry, a vaccine is coming. The state is working with Cindy Martin and with our other healthcare leadership around having us be a point of dispensary. We'll work with CVS, I believe, on that and have our folks tested. Cindy is working really hard with the state to ensure that not only are our healthcare workers and our healthcare residents in the first wave of vaccination, but also our independent residents. So we don't know that for sure yet, but as Cindy said, she's using all of her charms to ensure the state understands that this is communal living and our residents are highest risk age population. So more on that. And then the last thing I would just say to you is, you can watch the news and you see the cases going up. You can watch the news and you can see that people are sick of this. It is COVID fatigue. But for now, good things are coming. Better testing, vaccination, more access to ways to understand how to avoid the virus. We need a few more months of being strong, of being smart, and for one another. And what does that mean? That means limit your interactions with people you don't live with. It means wear your mask, wear it properly over your nose, over your mouth. It means avoid restaurants. It means avoid being around any people that you don't know. We can live our lives. We've adjusted. We're almost there. So hang in there. We're making progress. We've got a few more months of this. And it's dark out and it's kind of a bummer, but you know what? It's better here than anywhere else. So until then, stay healthy, my friends.